The most dangerous side effects of metoprolol are not always the ones listed first on the label. If you're taking metoprolol and experiencing certain symptoms, ignoring them could put you at real risk. What you're about to learn may completely change how you look at this very common heart medication. Metoprolol is widely prescribed to control blood pressure, protect the heart, and reduce strain on the cardiovascular system. Millions of people take it every day, often for years, trusting that it's doing its job quietly in the background. And for many people, it does. But like all medications that affect the heart, metoprolol can also produce side effects that are easy to miss, easy to dismiss, or mistakenly blamed on aging. Some of these reactions are clearly mentioned in prescribing information. Others are rarely discussed during routine appointments, not because they're rare, but because patients don't always recognize the connection. One particular side effect is especially overlooked. It often develops slowly, feels normal at first, and is frequently brushed off, until it leads to serious complications that send patients seeking urgent care. And it can happen without warning. Before we continue, it's important to be absolutely clear. This video does not advise you to stop taking metoprolol on your own. Stopping a heart medication suddenly can be dangerous. Some people believe all medications are harmful. Others assume that if a drug is commonly prescribed, it must be completely safe. Both assumptions are wrong. The purpose of this video is education, not fear. By understanding how metoprolol works and how its side effects can appear, you'll be better prepared to work with your doctor and protect your health. In the next few minutes, we'll break down the most important metoprolol side effects you should never ignore, including one that affects many long-term users, yet is rarely mentioned during routine checkups. Disclaimer: this video is for educational purposes only and is not a substitute for professional medical advice. If you have concerns about your symptoms or medication, consult your healthcare provider or seek emergency care when appropriate. Sources used for this video are listed in the description. 1. Fatigue. Fatigue is one of the more commonly noticed side effects in people taking metoprolol, especially during the early weeks of treatment. Reported in up to about 10% of older users. It usually doesn't feel dramatic or alarming. Instead, it shows up as a general sense of low energy, where everyday activities seem to take more effort than usual. This happens because metoprolol works by calming the heart's response to adrenaline. By slowing the heart rate and reducing how forcefully the heart pumps, the medication protects the heart from strain, but it can also lower the body's overall sense of drive, similar to easing a busy engine down to idle. As the medication remains active in the body, particularly in older adults, this effect can feel more noticeable. Age-related changes in metabolism can keep the medicine active longer, which may make tiredness more apparent, even though the heart is being protected, not harmed. Fatigue is more likely to be noticed in seniors and during dose adjustments or the first few weeks of use. Doctors generally view this type of tiredness as expected when it is mild, steady, and gradually improving. It becomes more concerning if fatigue suddenly worsens, interferes with basic function, or appears alongside unusual weakness, which is why clinicians may recheck pulse and review the dose. In daily life, this side effect often shows up as needing to pace activities more carefully, taking shorter walks, resting between tasks, or adding brief breaks while still enjoying normal routines and hobbies. For most people, this adjustment helps keep fatigue manageable without major lifestyle changes. 2. Dizziness when standing. Dizziness when standing is another commonly noticed side effect in people taking metoprolol, especially in older adults. It usually feels like brief lightheadedness right after getting up from a chair or bed, not a spinning sensation, and not constant. This happens because metoprolol lowers blood pressure in a steady, controlled way. When you stand up, gravity pulls blood downward. Normally, the heart responds by beating a little faster to keep blood flowing to the brain. But metoprolol intentionally slows that response to prevent sudden pressure spikes. As we age, blood vessels naturally become stiffer. That makes the body's automatic adjustments slower, so the brief drop in brain blood flow can feel more noticeable. The medication is doing its job safely, but the balance takes a moment longer. This effect has been reported in up to about 10 to 15% of seniors, most often during the first weeks of treatment or after a dose change. Doctors usually consider it expected when the dizziness is mild, short-lived, and improves as the body adapts. Closer attention is needed if it leads to fainting, repeated falls, or doesn't improve over time, which may prompt a dose review or a check for dehydration. In daily life, this side effect is often managed with simple habits: sitting for a moment before standing, rising slowly, and moving carefully on stairs or while gardening. With these adjustments, most people are able to continue their routines safely and comfortably. 3. Slower heart rate. A slower heart rate is a well-known and often expected effect of metoprolol, especially in older adults. Metoprolol works by blocking signals that normally tell the heart to beat faster. As a result, the heart may settle into a steadier rhythm, often around 50 to 60 beats per minute, like a clock ticking calmly and evenly. This effect is usually beneficial. By slowing the heart down, the medication reduces strain and prevents the heart from overworking, which is especially helpful for people who are prone to racing or irregular heartbeats. Since the heart naturally slows slightly with age, this change can feel noticeable, but not harmful. A slower pulse has been reported in about 5 to 10% of older patients, and in most cases, it causes no symptoms at all. Doctors mainly focus on how the person feels. A steady, slower pulse without symptoms is generally considered safe. Closer monitoring is needed if the heart rate drops below 50, or if it comes with dizziness, fatigue, or faintness. In those cases, clinicians may adjust the dose or review other contributing factors. In everyday life, many people actually notice a calming effect during stress or activity. For reassurance, some patients choose to check their pulse at home from time to time. When symptoms are absent, this side effect usually has little impact on daily routines or quality of life. 4. Cold hands or feet. Cold hands or feet are another side effect some people notice while taking metoprolol, especially older adults. This happens because metoprolol relaxes blood vessels and slightly slows the heart's output. As a result, blood flow is directed more toward vital organs like the heart and brain, and less toward the outer parts of the body, much like turning down the outer flow of a faucet. With age, the skin becomes thinner, and circulation to the hands and feet is already reduced. That makes this cooling sensation feel more noticeable, even though the medication is working safely to protect the body's core. Cold hands or feet have been reported in about 5 to 8% of older adults, and in most cases, the sensation is mild and not painful. Doctors usually consider this expected, especially when warmth quickly brings relief. Closer attention is needed if the hands or feet become painful, very pale or bluish, or develop sores that don't heal, which may signal a circulation issue that needs review. In daily life, most seniors manage this side effect easily, wearing gloves or warm socks for errands, keeping hands covered in cooler rooms, and staying comfortable without limiting normal activities. 5. Less stamina during activity. Some people notice reduced stamina during physical activity while taking metoprolol, especially older adults. This happens because the medication limits how much the heart rate can rise during effort. It acts like a safety governor on an engine, keeping the heart from revving too high. That protection is intentional, but it can make activities feel harder sooner than expected. As we age, muscles naturally tire more quickly. When the heart's speed increase is gently capped, the body may need more frequent pauses during movement. The medication is preventing overload, not causing harm. It's simply changing how effort feels. Reduced stamina has been reported in about 5 to 12% of seniors taking metoprolol. For most people, this shows up as needing to slow the pace, rather than stopping activity altogether. Doctors generally expect this adjustment, especially early on or after a dose change. They pay closer attention if there's a sudden drop in exercise tolerance, or if symptoms like chest pain appear, which may prompt a heart check. In daily life, many seniors adapt by shortening walks slightly, moving at a steadier pace, and enjoying activity without pushing through fatigue. Over time, this approach often supports consistent fitness while keeping the heart protected. 6. Mild shortness of breath. Some people notice mild shortness of breath while taking metoprolol, most often during physical effort, and more commonly in older adults. This happens because metoprolol gently influences beta signaling in the heart and lungs. During exertion, the heart doesn't speed up as much, and the airways may feel slightly tighter than usual. At the same time, aging lungs naturally have less reserve, so this change can be more noticeable. The medication is designed to support heart-lung balance safely, reducing strain on the heart rather than causing damage. For most people, the sensation is mild and improves with rest. Mild shortness of breath has been reported in about 3 to 5% of elderly patients and is usually temporary. Doctors generally consider it expected when breathing feels slightly limited only during activity and returns to normal with rest. Closer evaluation is needed if breathing problems worsen or are accompanied by wheezing, chest tightness, or new swelling in the legs, which may signal a heart or lung issue that needs review. In daily life, most seniors continue to do well with gentle activities, such as chair exercises, light walking, and paced movement that allows comfortable breathing. With these adjustments, overall breathing remains steady and manageable. Understanding these side effects helps you stay confident, calm, and in control of your health. Remember, most side effects are simply your body adjusting, not a sign that something is wrong. When you recognize them early, you and your doctor can make smarter decisions together. If this video helped you understand your medication a little better, go ahead and tap the like button. It lets YouTube know this information matters and helps other people find it too. And if you want clear, calm explanations about medications, especially as we get older, consider subscribing to the channel. I'll see you in the next video.